When we think about mosquito-transmitted diseases, all you have to do is pay attention to the news and you've learned about a new mosquito-borne disease, which is actually not that new. It came about in the 1940s, but that's Zika virus. Zika virus is in a family of viruses that includes dengue, that includes Japanese encephalitis, and its commonality is that it's all spread by a very common mosquito called the Aedes mosquito. And the Aedes mosquito is kind of like the urban tough mosquito, right? It's not the dainty, clear water mosquito like the malaria mosquito is. This one will breed in a teaspoon of water. It lives in tin cans and discarded tires. It's an urban mosquito. Well, the problem with that is urban areas are where people live. So unlike rural areas where diseases are a little hard to be epidemic, in an urban area it can explode. And that's what happened with Zika. So Zika is transmitted by the Aedes mosquito, which is a day-biting mosquito. And in Brazil, where one of the largest outbreaks has been documented, it has some special features that were unexpected. Because this virus, or this version of the Zika virus, tended to be more neurotropic. And by neurotropic meaning for pregnant women, it affected the fetus so that we now see microcephaly as being linked to the Zika virus. Guillain-Barré syndrome has now been linked to Zika virus. So unlike dengue fever, for example, which is also a very common mosquito-borne disease that's transmitted actually almost in the same places that Zika is, and by the same mosquito for that measure, it doesn't cause nearly as much as neurotropic disease as the Zika virus, at least that version of the Zika virus in South America. Fortunately for the spread of Zika, it's fairly contained right now to the South American and Central American continent, but we are seeing imported cases now throughout the world. Because this mosquito is so abundant throughout the world, we are very, very nervous about global outbreaks of Zika. So that's why you see the CDC and the WHO getting heavily involved. What's really different with Zika, though, is the specificity of who should or should not travel and the sexual transmitted part. When we think about Japanese encephalitis and dengue, we don't think about sexual transmission. We think about mosquito to human only, right? But Zika is a little different. So outside of the fetal abnormalities, we also know that Zika virus gets into semen, for example. So newer information coming out suggests that men who have traveled to Zika endemic areas, let's say, for example, if they travel to the Olympics and come back from the Olympics, even if they weren't diagnosed with Zika or they didn't have symptoms, they still should practice safe sex, meaning condoms or abstinence, for 8 weeks after they get back. If they were exposed and they were diagnosed with the disease, and for males and other people who get Zika, it's not a very severe disease. Most of it, actually half of it's asymptomatic. If they're diagnosed, they should abstain for 6 months before donating blood or having unprotected sex. So it's a very unique virus that's causing, in some circles, and I guess maybe the press might play into this a bit, some panic among people. But the CDC has been very firm, and they have not been, sometimes they're overly conservative in their recommendations, but they hit this one right on, saying, we're worried about it perhaps starting in the United States. We've already had people who have imported it and who have delivered, there's 2 cases already I know of, delivered a microencephalic child. We know that we have the mosquito population, so we know that we can also establish Zika in the United States.